In this interview, I'm talking with Dr. Jared Skowron, a board-certified naturopathic physician with over 20 years of experience specializing in biomedical treatments for autism. He's the founder of Spectrum Awakening, creator of a top-selling supplement line for neurodevelopmental support, and a national speaker who's helped thousands of families, including mine, uncover the root causes behind their child's symptoms, whether it's gut dysfunction, immune dysregulation, or brain chemistry imbalances. In this conversation, we dive into some of the most pressing issues: the rise in autism rates, why traditional medicine so often misses the root causes, and how targeted interventions guided by labs, symptoms, and clinical insight can actually lead to real progress. Dr. Skowron brings both research and heart to a topic that leaves many parents feeling powerless. If you've ever been told there's nothing you can do, this interview will show you otherwise. Dr. Skowron, thank you so much for coming on the podcast. I'm so excited to chat with you today. I have so many parents asking me questions about their kids who are on the spectrum and how they can get them more help. And I know I've worked with you in the past with my son, and you are full of so much knowledge. So I don't want to waste any time and want to jump right in to the
Well,
questions.
thank you, Brittany. I'm really excited to be here. I'm really excited to talk to more parents and more families who have kids with autism. They're trying to figure out ways that they can help.
Yes, definitely. All right, so where should we start? I think one of the big questions that parents come to me with is, I think something's up with my child. I don't know what it is. I went to my pediatrician and they brushed it off, or they told me to just go to therapy and there's nothing else I can do. What advice do you have for them?
Well, my first advice is listen to your mom instinct. Or for dads out there, listen to your dad instinct, because we as parents, and I got a 12-year-old, we know our kids better than anybody else, period. Better than any doctor, better than anybody else, because we're with them 24/7. Okay. So if you have suspicion that something's up or something's different, I don't want to use the word wrong, like, hey, something's wrong. You think that there's something suspicious, just keep going. If somebody is just closing the door on you and dismissing you, just walk away and go to somebody else. Because unfortunately, our medical system and even our pediatricians, they are overwhelmed and overloaded, and they just do what they're trained to do. And most docs, unless they've got a kid with autism, okay, unless the pediatrician personally has a child on the spectrum, they're going to do what they were taught. And what they taught were, if I think this kid needs to be evaluated, send them to early intervention to get eval'd, and then go to therapies. And that's what they were taught. And they've got 30 more kids in the waiting room that they've got to help. Okay. So it's, unfortunately, our medical system is overloaded. Everything is fast. Frankly, most pediatricians are taught to do three things. Okay. When I went into pediatrics, they said, look, you only have to do three things: well baby visits, shots, and antibiotics, and everything else you just send to another doctor. So that's the training. And our pediatricians are not familiar with autism unless they're personally involved.
Yeah, I mean, that's definitely been my experience. So I'm super happy I kept pushing, because there's so much we can do to help our kids. And I've seen it firsthand, and even working with you, like my son is doing really, really good. They always describe autism as this puzzle or this wide spectrum, but I love how you do everything you do, you tie back to research, which a lot of people think there's not research on this stuff. And there is a lot. I just don't know why
Mhm.
it's not exposed.
Yeah.
So what do you think are some of the most overlooked root causes you see in autistic children that traditional medicine just totally misses or blows off?
So there's really, in my opinion, and again, I've been in private practice for 21 years, working with our kids with autism for 21 years. So I've not only have I seen kids and the different ways that they are, different kids, different symptoms, but also how well they can recover and how autism has changed since the beginning of the century. I mean, I started med school in the 20th century, and man, things have changed over the past couple decades. And I think when it comes to why, and this is a great question, parents should know why. Why does my child have developmental delays? Why were they diagnosed with autism, but not all these other kids, right? The research shows that about a third of our kids, and for females, it's about 50%, born with a genetic abnormality. Okay. The technical term is genetic mutation, but it starts sounding like X malady. But it's just a piece of our DNA, and we have 20,000 different genes. And if one of them's not working, if one of those pieces of DNA that controls brain development isn't working, our kids are going to have slower development and eventually be diagnosed with autism. Most doctors just kind of ignore those things unless they're really evident. All right. And as an example, if you see somebody on the street with Down syndrome, they have a very unique look and presentation. You can look at them and say, you know what? They probably have Down syndrome, and you're probably right. And so doctors tend to think other genetic conditions, children will look a certain way. And so if they don't see that, they just ignore genetics and just kind of keep moving on. But it's all types of people who look like all different things, right? Really doesn't matter. That rule, like, hey, you need to look different to have a genetic diagnosis, that's not real anymore. Okay. So they're not doing the testing. They're not referring out. Say, hey, you should go to see a geneticist. You should get your genetics tested. That's part of their conventional protocol. They just don't do it. They send you to therapy. They send you to early intervention. And then that's like a third of our kids. I truly believe, and we've done the testing on hundreds and hundreds and hundreds of kids. We see these genetic issues, right? Some of them are treatable, which is great news. The other 2/3 of our kids have a regression. And this is much more common. And this is the common story where somewhere between 12 to 18 months, all of a sudden you've got your baby and they're making a few words and they're making eye contact and you're reading books and they're making animal sounds, and then it's gone. And then all of a sudden it disappears. The language is gone. The eye contact is gone. The personality is different, right? And so what causes that regression? Nobody wants the finger pointed at them. Okay. There's lots of talk about environmental toxins. There's lots of talk about chronic infections. There's a lot of research behind Tylenol and acetaminophen and paracetamol, but it's all about something that's toxic, whether it be lead, whether it be some other kind of chemical toxin, whether it be an infection. If something gets into our brain and stops or delays development, it's that's really causing that trigger. Okay. And I think doctors in general don't want to say, oh, I'm going to go down this road and figure out this for you. Because again, I got 30 other people in the waiting room. I'm just going to send you to therapy. So they're ignoring it because they don't feel like it's their job. Okay. And so again, when you get to like, hey, let's point the finger at this, let's point the finger at that, let's point the finger at that. No company out there wants it. Right? Nobody wants to say, hey, yeah, there's lead in the water in Flint, Michigan, which we know there is, and there's all these kids with autism because of that. No, we don't. Nobody wants a finger pointed, but it's something getting into the brain at an early age that causes the delay.
It's heartbreaking because at the end of the day, it's like people should just want to help kids, and us desperate parents don't know where to start. So when you're trying to identify these root causes, what type of testing do you recommend parents start out with or ask for for genetics, and then also for like biomedical?
Right. Well, I love that question. And I love the question because the goal and the end result of that question is an answer, and it's a treatment, and it's not just a why, but it's a what do I do? It's a how can I help my child? Okay. Because autism is a medical condition. All right. And I know a lot of families who are new to autism may not be aware of that. It's a medical condition that's changing not just how the brain is developing, but other parts of the body are changing. So with medical conditions, there's stuff inside that's functioning differently. Some things functioning too much, some things not functioning enough, right? And that's how medical conditions happen, like cholesterol. Hey, my body's making a lot of cholesterol. Now I've got high cholesterol. So we do this medical testing, or as you mentioned the term biomedical, which is kind of the term of the day for more comprehensive medical testing about how, and again, they call it biomedical, which is a combination of biology and medicine, but it's basically looking at how the body's functioning. So we do those tests to find out how the body's functioning well or underfunctioning, because if we have something that's too much or too little, this is where we base our treatments on. And it's these treatments that help our kids develop faster, more language, better behaviors, better sleep, better gut issues, seizures. I mean, you name it. There's so much stuff going on with our kids. So, you want to test for what's going on, right? And so patients in my telemedicine practice, we'll pick testing based on their symptoms, based on, hey, you know what? I've got constipation. I poop once a month, or I've got real fine motor problems, or I have 30 seizures a day. So, different testing for what's going on. But in general, this is what I tell people. If you want to start out with something, Number one, going back to what we just talked about, how do kids get on the spectrum, right? Are they born with genetics that aren't working, or is it a regression around 12 to 18 months? For kids who kind of always are slow to develop from the beginning, okay? And this is really easy to watch if you've got older kids and you saw how they developed, or you've got neighbors or family members who are a similar age. Watch your child's development those first 12 months. And if it's slow and you're like, there's something's different. I don't know what. I don't know what's going on, but something's different. These are the kids who often have genetic issues. So those are the ones that I fast tracked to genetic testing. And you mentioned a couple. You mentioned Fragile X testing, microarray, and a whole exome sequence, or a WES. Those are the conventional medical tests that we use to identify genetic causes for developmental delays and finding a treatment for them. Because a lot of people, even doctors, don't think you can treat genetic abnormalities, and you can. Okay. You can't change them. I mean, our DNA is our DNA, but you can make life better based
Yeah.
on what's not working in the body. Right. So if you've got a kid slow to develop the first 12 months, you were always suspicious of something, go with the genetics first. For those kids who have a regression, I normally look at two tests. One test is a stool test, because of a lot of our kids, and I'm sure we'll talk about this later, a lot of our kids have infections in their gut, in their intestines, in their stomach, in their colon. They have infections. They have yeast, they have bacteria, they have parasites and worms. I mean, all sorts of crazy things, right? So we look for that so we can treat it and get rid of it. The other test we often recommend is called an OAT test. And OAT is an abbreviation for organic acids test. And organic acids are like 30 to 50 different chemicals in the body that, kind of control everyday function. How does our body take the food that we eat and turn it into everything, turn it into energy and hair and my heart and everything? Okay.
Mhm.
So these organic acids are often dysregulated in our kids, and there are treatments based on that. So again, and there's a lot more tests out there, because we will test neurotransmitters, brain chemistry, and hormones. We'll test food allergies and all sorts of different things. So, but if people were like, hey, what testing should I start with? The most bang for the buck. It would either be the genetics for those slow developers from the beginning, or if you had a regression, look for this advanced stool test or an organic acid test.
Okay, sounds good. What about what would you say for, I mean, I feel like a lot of parents say their children deal with chronic issues like candida and parasites and constipation. Why is that such a hallmark symptom for our
Yeah.
kids on the spectrum?
Yeah. And let me throw toe walking in there too.
Yeah.
Because when I'm constipated and I got to get to the bathroom, I kind of walk on my toes to get there. So, I want everybody who's listening to think back to the old phrase fight or flight. Okay. When there's stress, okay, we go into fight or flight. When there's no stress, we're just hanging at our baseline, whatever that baseline may be. Hey, I'm happy. I'm always worried, whatever. I'm my baseline self. Okay. When we have a stressor, we're going to go into fight or flight. Right.
Mhm.
And part of that fight or flight, and you know what? Before I go into that, let me use a metaphor that I often use. Imagine you were in bed, it's nighttime, you're asleep, and you hear a window break in your house. Okay. All of a sudden, you are going to be up. You're going to be
Yes.
awake. All your senses are going to be on overload. You're going to hear every little sound. You're going to see in the dark. Like all of your senses are going to be heightened.
Mm-hmm.
Somebody next to you in bed is like, what was that? Like, shush, be quiet. I'm listening for this danger. It's somewhere. That's that sensation of fight or flight that we all have. Okay. Our fight or flight then, fades away after we realize we're out of danger. With our kids on the spectrum, they are in this fight or flight state. Okay. We don't know why.
Mm-hmm.
It's probably because of whatever caused that regression back in the time. And again, the genetic kids don't have this as much. It's the regression kids. But those regression kids are in fight or flight. Some doctors call it a cell danger response, which is kind of talked about there online a little bit, but it's the same thing. Okay. The body feels like it's in danger. The body goes into fight or flight. When we go into fight or flight, different things happen in the body for all of us, not just autism, but all of us. Our energy is directed into survival. Our energy is directed into running and escaping that tiger. Okay. Our energy doesn't care about food. I'm not going to sit here and eat a 5-course meal when there's a tiger chasing me. I'm going to eat my sugar and my carbs and shove it in my mouth and run. Okay. Other parts of the body also start to get turned off. And one of those is the immune system. And one of those is digestion and the gut. Okay. Because again, if I'm being chased by a tiger, my body's not going to stop so I can go to the bathroom. It's going to shut that down. Because if I stop and go to the bathroom while the tiger's chasing me, the tiger eats me. So all of a sudden, with all this fight or flight, the gut shuts down. So now we have constipation. Okay. The immune system of the gut shuts down. So now we're predisposed to infections. And those infections can be anything. Like you mentioned, there's candida, which is a form of yeast. There's a lot of talk about mold over the past 5 years. Mold's another fungal infection like yeast. Okay. We've seen, I mean, just the past week alone in my practice, I've seen C. diff, I've seen H. pylori, I've seen kids with 2 parasite infections. That's just this week. So those infections are everywhere. We all get them. Okay. We're all exposed to them. But normally, if you're healthy, your immune system will knock it out and get rid of it. But our kids, their gut immune system, that shut down, GI motility shut down, so you get constipated, and that just lasts for years and years and years and years and years until you change that. It's going to last a long time. And though that lack of digestion, that constipation, those infections, they are the cause, hands down, the cause for 80 to 90% of our kids' bad behaviors. The
Wow.
self-injury, the hyperactivity, your kids are just bouncing off the wall. They're not sleeping. I mean, I had a kid, this story is a few months old, about to get kicked out of school. I mean, how many, parents have had kids whose behavior's so bad, the school's like, I'm sorry, I know we're an autism school, but he's just too much. We can't have him. We can't handle him. There's people in danger, right? How many of your viewers have kids on risperidone, to stop the violence? So we had one kid, again, a few months ago. He'd been to like 4 or 5 different autism schools. The behaviors are just so aggressive. The parents had a lock on their bedroom door so the
Oh,
child wouldn't enter their bedroom at night. Okay.
breaking.
I know it is heartbreaking. They put him on a zillion psych meds. Everything made everything worse. We did our stool test. We saw he had a parasite. We killed the parasite. And in 2 weeks, parents said 90% reversal in behaviors. Be like, this kid went from the devil to an angel because he was in pain. He was in pain from parasite in his belly. Okay.
Wow.
And again, this is just me soapboxing. I hate when parents go to the ER and go to doctors and they say, and the kid's screaming because they're in pain. And the doctor says, yes, he's just autistic behaviors. Get out of my sight. Here's some, whatever. Here's some risperidone, which is just a, pharmaceutical straitjacket. Just shut him up. Get him out of here. I got more work to do. I hate that.
It's horrible.
It is. Our kids suffer.
But you have a lot of solutions, natural solutions and you tie everything to research too, which is so great.
Right.
So what would you recommend to a parent listening to this who's like, yeah, my kid is constipated, aggression, something's going on. I
Yeah.
think it's in the gut.
Yeah. So I tell most families start here. A lot of people will ask me, obviously with our podcast, our Facebook Live and stuff, and
Yeah.
parents who are not patients of mine say, where do I start? I want to do something. I'm really excited. What do I do? Okay. And it's timing is always coincidental and works out. We're about to launch a beginner's bundle of supplements this Thursday for our
Ooh,
podcast.
that's
Just
awesome.
came up with it today. So it's perfect timing. Parents ask me, where do I start? Okay. And the place to start is, first off, how are your child's behaviors? Okay. That's where we start. All right. If you've got a kid who's pretty happy and I say he a lot because autism's mostly boys, 4-to-1 boys, girls, but for anybody, um, you know, does your child have, behaviors that are out of the norm, for their age? Yeah. 5-year-old boy, he's going to be hyper. Right. But is something out of range and school is concerned? Okay. The first thing to do if you got behaviors is make sure they're pooping. Hands down. Our kids are chronically constipated. They may go every day, but if they're just, if you just get a little bit out every day, it's not everything, right? A lot of our kids are chronically constipated. I remember when my daughter was potty training, and she's 3 and she goes to the bathroom. I'm like, where did you put that thing? It's popping out of the water. How is it so big? Right. And so this is how we should all be pooping, right? So if your kid has a little poop every day, no, it's not enough. Maybe they even have 3 or 4 every day and it's small. It's not enough. You want it all to come out every day. That's pooping. That's what should happen. Okay. Nobody feels good when they're backed up
No.
at all. Okay. So you're going to have kids who are cranky. You're going to have kids who are hyper, and you're going to have kids who toe walk because they're constipated. So start there. Now, as you mentioned, I focus everything on research, because there is so much scientific research behind autism, behind how the body works, behind what we should do that I want to share that with everybody. This isn't just me saying, "Hey, here's 20 years of experience and here's what I do. You should try it." There's science behind it. People have been
Yeah.
researching this around the world. And so the other thing that you mentioned is I focus on natural therapies instead of pharmaceuticals.
Yes.
I think there's a place for both. Okay, some of my kids, I said, you probably these pharmaceuticals probably going to be better for you than this natural stuff, especially when we get into treatment of really chronic infections. We'll add on the pharmaceuticals onto the natural. But there is no pharmaceutical, period. There is no pharmaceutical that helps with development. That's it. There's no pharmaceutical that helps autism. There's pharmaceuticals approved to help violent behavior. There's pharmaceuticals that are prescribed to kill infections. I hate antidepressants in our kids because one of the biggest side effects of antidepressants in teenagers is suicide. And so if our kids can't express how this Lexapro or Prozac is making them feel because they don't have the verbal skills, why are we even going there? So there's so much better naturally that we can do. And it's more effective, frankly. So where do we start? You start by making sure your child can poop, period. I don't like Miralax. There's neurological and behavioral side effects to it that are published. So stray away from that. What did we all use in medicine before Miralax came around was magnesium. Magnesium's been used for hundreds of years, literally since the 1600s, to help with constipation. We pair magnesium with electrolytes, and that works even better, but you got to make sure you're moving your poop.
Mhm.
After that, if your child has behaviors, they likely have a gut infection. So you should treat that next. I like to treat gut infections primarily with two things. One's called a binder, and a binder is like I talk about water filters, like a Brita pitcher. You put your water in, it goes through this cartridge, and the cartridge grabs the bad stuff, and you get the water with the good stuff underneath.
Mhm.
A binder. Okay. So we give binders to our kids to grab the bad stuff, poop it out, the good stuff remains. So you combine that with something that's going to kill the infection. I like colloidal silver a lot because good quality colloidal silver kills parasites, kills bacteria, kills candida, kills mold, it kills it all. And it's practically tasteless. So for our kids with picky eaters, easy. So you start there. Now, once the behaviors are good, maybe your child already has good behaviors or this helps your behaviors, that's when we go into the brain treatments to help with the language. Folinic acid has been all the rage past few months because of what came out on CBS News and the Daily Mail out of the UK. It's been huge. I haven't even kept up. Has there been more media and news about folinic acid?
Probably. I mean, I'm just shocked so many parents don't know about it. But then again, it's I don't know, it just a lot of doctors don't know about it either when they go and ask and people, and then, I've just had so many parents, where do I get it? Where do I get it? I've referred a lot of them to Spectrum Awakening because I love your folinic acid product. And yeah, I mean, it's leucovorin sounds like a pharmaceutical, but it's actually just a vitamin. So do you want to talk a little bit about
Yeah.
that?
I would love to. Again, folinic acid, which is a vitamin, has been all the rage the past few months because there was a news article on CBS about it where a family gave folinic acid to their child, and I believe it improved their language and their mental cognition, and the child was drastically improved from that. And in the autism world, we've known this for a good 5 to 10 years. Researchers and scientists, and Dr. Fry is one of the big ones here in the US that does this research. And we've known in our community this vitamin helps kids with autism. It helps their language. There's 50 plus research studies on folinic acid and autism, and it improves their language. It can help their behavior. It can help their mental cognition and awareness. It can help with seizures. I had side story. I had a kid who out in Oregon, great family. This kid had 30 seizures a day. Okay. He had to wear a helmet because the parents would never know how many times an hour he would just boop, fall down and hit the ground. Right. Now he was taking the highest dose of seizure medication that he could for his age. So he was ramped up on the seizure meds, still having 30 a day. We gave him folinic acid. In 1 week, he went from 30 seizures to 0. Period. That's it.
Wow.
That's it. And guess what? There's plenty of science behind it. There's plenty of research showing folinic acid helps seizures. Vitamin B6 helps seizures. It's in the research. Why don't the neurologists know and do this? I don't know. But it's there.
So why is speech one of the big I guess like improvements you get from taking it? Like what
Right. Well, I've got half an answer. So,
Okay.
what folinic acid does, and again, we've been familiar with folinic acid, been using folinic acid for 5 to 10 years. It's great. Not everybody responds to it, because again, that's autism. That's the spectrum. Some things work for some kids and not for others.
Yeah.
But what it does is this vitamin pairs up with proteins in the brain. Okay. And this is kind of part of our, I don't want to call it like a folinic plus treatment, but a lot of people using folinic acid, and that's awesome. But there's more things you can add on that'll work better. And
Yeah.
these are proteins that'll, combine together with the folinic acid to become different neurotransmitters, different chemicals in the brain. These are how these things are made. These are how our body creates things from the foods we eat. Okay. And so it creates serotonin, which makes you calm and happy and relaxed and sleep. And it creates dopamine, which gives you focus and motivation and concentration. And you need folinic acid to create all these things in the brain. And it's those neurotransmitters in the brain that help with the language development. Okay. Exactly how? That we don't know. We're like, hey,
Yeah.
here's more serotonin in the brain. They're talking more. How did that work? I don't know, but it's working. So it's you can get it. There's a lot of different places to get folinic acid. Folinic acid has also been branded as a pharmaceutical called leucovorin. So leucovorin, the pharmaceutical, and folinic acid, the over-the-counter generic, as I call it, exact same thing. Okay. The exact same thing. It's like getting a multivitamin. Hey, you can go buy a multivitamin wherever, right? But when my wife was pregnant, she got prescribed a prenatal and got it from the pharmacy. Okay, same thing. One came from a pharmacy and one's over the counter, same exact stuff. That's why leucovorin, I know I'm kind of tangenting here, but that's why folinic acid is so important, because it helps that brain function to create those brain chemicals to get their neurotransmitter. The biggest question is dose. We've got to get the right dose in your kid, because you can go with a small dose that you can get over the counter, right? Or the scientific research is using these really big doses. And that it's those really big doses where we at Spectrum Awakening, I think we're the only place that offers these really high doses of folinic acid over the counter.
Yeah.
Unless there's somebody I just don't know.
Yeah. Oh, that's really helpful. I do get a question from parents because we use folinic acid and we have for about going on 2 years, I guess, and have seen a lot of gains from
Oh,
it.
good.
But some parents say that their kids get hyper on it. So is there like other cofactors or other things to give with it, or what would cause that, or what should they do?
Yeah, great question. We're all different, and again, I love metaphors, so I'll give another. Think about different people and how they respond to coffee. Okay, so I drink probably 5 or 6 espressos a day, right? And I'm good. I enjoy it. I feel good. I go to bed at night. I pass out.
I would not be good.
Right. Right. Because your body cannot remove the caffeine like other people.
Yeah.
Like for you, how many coffees can you have a day before it affects your sleep?
One cappuccino with breakfast, and I can't have caffeine after noon.
Yeah. And so we're all different. That's exactly it. We're all different. You get caffeine out of your body very slowly compared to the average person. I get it out of my body really quickly compared to the average person. And so there are side effects to coffee depending on the person.
Yeah.
Okay. Same thing with folinic acid. Folinic acid making all these neurotransmitters and brain chemicals. One of them is called adrenaline. And adrenaline's our fight or flight chemical, like we talked about. So we see certain kids get hyper. The research says like 10% of kids, I think it's more. But if your child's hyper on this stuff, it's a typical side effect because your brain is making more adrenaline and that puts you more into fight or flight. So there's 2 things to do. Number 1, I find sometimes we go into the folinic acid treatment too quickly.
Mm-hmm.
Hey, it's really popular. It's on the news. I saw it on social media. I want to try it. But if your kid has those behaviors that we talked about, if they've got a gut infection, if they're already in fight or flight and you shove more adrenaline in there, it's going to get worse. So one thing you can do is, all right, let's pause the folinic acid for now. Let's work on this whole gut infection stuff. If there is a gut infection, let's get rid of it. Okay. One thing I didn't talk about, we were talking about gut infections, is you can get a stool test. You can get a really good stool test and check for those infections, see if you have. Don't have to do it. You can just treat it, but it's not. So kids who have those gut infections and you get on folinic, more likely to be hyper. Okay.
Okay.
So clear those gut infections first, then get on the Flinic, less risk of those side effects. The other thing you can do is add other vitamins that will help remove the adrenaline from your body. Like with coffee, if there was something you could take to get rid of the caffeine faster, you could drink more coffee if you wanted to. So what we use to get rid of that adrenaline is a combination of magnesium,
Mhm.
vitamin B6, vitamin B2, and then a mineral called lithium orotate.
Okay.
Now, most of the time I say lithium, you're going to think the drug, but lithium is a mineral. Okay, they dig it out of the ground, they put it into batteries, lithium battery, that's not like the drug. It's lithium from the ground. If you remember high school biology and the periodic table, up on the top left is lithium right there. It's a natural
Yeah.
substance. And it's incredibly calming to everyone. And it's because it helps you get rid of this adrenaline. So I put all of those together in this formula called anger management, which helps drop that adrenaline levels. So there's a couple things to try.
Awesome. That's super helpful. Okay. So when a child is reacting, like, I guess, poorly to a supplement, how
Yeah.
can parents tell if it's a detox reaction or a die-off effect or the wrong fit, or do they need to keep
Yeah.
going, or what side effects, I guess? Or does that
Yeah.
just mean that the brain is like being stimulated because it hasn't had what it needs, I guess, for a period of
Right.
time?
It's a great question that has a couple answers. I would say answer number one, and this is what I tell all my patients, always start one thing at a time. Okay.
Yeah.
Because if there is an effect and you're like, and you started 10 things all at once, you're like, well, what was that? Well, I don't know. Right. So one thing at a time, feel free to start with a small amount, and work your way up to the full dose, because like you said, if you don't have something and you're like, here, try it, it's like, you get overloaded. So, kind of stepping into it will improve how the body accepts it. And then you mentioned the word die off. And I think it's a great thing to talk about because we should differentiate side effects, whether they're a die off reaction, which I'll explain, or just a side effect, right?
Mhm.
And so a die-off reaction is kind of the term that we use for when you're killing off gut bugs. Okay. When you're killing other infections. Okay. They talk about this a lot with Lyme disease. When you're killing those bugs, you may feel worse before you get better. Okay. And it's because all those organisms are dying. They're dying off. And when they die, they break open and everything that's inside them spills out and our body has to deal with it, and that can make us feel worse. So these are called die-off reactions, and these happen when you take something that is some kind of gut treatment and you get worse behaviors or worse symptoms. Okay. A lot of people, and I talked to a lot of patients about this, they started probiotics and my kid got worse. Or I started inulin and my kid got worse.
Yeah.
I took whatever gut supplement or gut treatment and things got worse. Those I classify as a die-off reaction because the goal of those treatments is to kill infections that we don't want. And when we do that too fast, our body just can't handle it and it feels bad. So that's why we always do two things, like we talked about before. You got to make sure you're pooping. If you're killing infections in your belly, they better get out as fast as possible. So make sure you're pooping. And number two, that's why we use the binder. So when you do these gut treatments and you have side effects, which happens, the more binders you use, the more you can grab, the better you'll feel. So that's a die-off symptom versus just other kind of typical side effects. Like if you had 5 espressos today, you wouldn't sleep. Nothing's dying in your system. It's just a side effect because your body can't handle the caffeine. So it's kind of different depending on what you do. But I would say this, if you're giving some kind of gut supplement or something to kill an infection and you have worse behaviors, pause, make sure you're pooping, add a binder, and then go at it. But if you're taking stuff for your brain like folinic acid, or we use a lot of 5-HTP, those side effects are just how the brain's wired versus like a die-off, you're killing something.
Okay. That's really helpful. I want to ask you now a little bit about detox. I feel
Yeah,
like there's a lot of rave online about, oh, I use this spray or
yeah,
this zeolite. And what is your take on detox? And if you do recommend it, what do parents do
right.
exactly? And at what point in the process of starting biomedical treatment, like, where does that fit in?
Right. So I always detox at the end. Okay.
Okay.
We're doing a bunch of things with our with our kids, okay, I want to know if they've got genetic issues, right? I want to know if they've got a constipation. I want to know if they've got a gut infection. We're going to treat that. I want to know what their brain chemistry is like. We test for that. You can test your serotonin levels, your dopamine, your adrenaline levels through your child's urine at a regular lab. You go to just a regular lab down the street. They all do this. So we look for the genetics if we think it's an issue. We go after the gut, the constipation, get those infections gone, get the poop moving. We go for the brain. Let's balance those neurotransmitters. Let's do the pholinic. Let's get the serotonin in there because the serotonin helps language.
Yeah.
Then after that, for me, those are like the first big three things. After that, there might be some issues with mitochondria, which we haven't talked about yet, but mitochondria produce
Okay.
energy for the body, and we need that energy for the immune system, for the gut, and for brain development. So mitochondrial treatments, sometimes we'll look at hormones and hormone balancing. Even before puberty, we've got hormones like thyroid hormone, other hormones. And then, so we kind of do like mitochondria, hormones, and the detox kind of all together after that. But you've got to make sure your gut is working before you detox. Because again, if you're constipated, your child's constipated, there's only four exit doors out of the body. Okay. We either pee it out, we poop it out, we breathe it out, or it comes out through our skin, right? Pee and the poop are the big ones. So if your child's constipated, you are not getting rid of enough toxins. Anybody who's constipated is not getting rid of enough toxins. So number one is get pooping. Right?
Mhm.
After that, it's all about what supplement, what do I want to use to grab the bad stuff so I can poop it out or so I can pee it out. All right. I want to get this stuff out, so I want to grab it. And that's where all these different detox supplements come in. Okay. Things like glutathione, things like alpha lipoic acid, things like zeolites, things like chlorella, things like charcoal, things like Epsom salt baths and bentonite clays, and there's all sorts of different natural substances that can be used for detox. Okay. And there's some stronger pharmaceutical ones as well. But I've seen plenty of kids on zeolites or whatever. And you're either going to do better or you're going to get worse. And I think the kids who get worse are the ones who are still constipated, the ones who aren't moving this stuff out of their body. So that's why we've got to go down get the constipation figured out first, get your poop moving, get any gut infections out of the way, then we can detox because it's the same exit door.
I see. Okay. That makes a lot of sense. Do you recommend against anything or specifically for a specific type of detox to do, I guess?
No, I would just say this. If you're going to do more intense detox, you know what? It hasn't really come up lately in the past few years because there's always trends and stuff.
Yeah.
Like people doing IV chelation doesn't seem as popular as it used to be. But if you're going to do some intense detox, do it with a professional. Do it with somebody who does it safely, knows what they're doing. Make sure you're supplementing with minerals because when we detox, we also detox our minerals out. So you don't want to lose too much calcium, too much magnesium, too much zinc, any of the good stuff. So make sure you're replacing. So whenever we do detox with our patients, we make sure they're on some really good multivitamin, multimineral like we have, or some other kind of mineral complex supplement to just replenish what you might have lost.
Okay. I know you mentioned mitochondria. We haven't talked about that really, but yet. So tell me everything I need to know about mitochondria dysfunction and autism because I feel like that's another major thing that comes up.
It is.
Um,
It is. And I'm glad for all your viewers who are still listening because we're talking about a lot of stuff in depth. Mitochondria, you remember this from high school, they're the powerhouse of the cell. Okay. What does that mean? That means mitochondria are the tiny little parts of every cell that create energy. Okay. So in practically every cell of the body except for fat tissue, has these little things that make energy so the cell can function and therefore the body can function. These mitochondria are very susceptible to toxic damage. So toxicity makes them not work as well as they should. So your mitochondria start to become sluggish or underperforming or hypo-functioning. They're still working. If your mitochondria were not working very well, you would be in the hospital. I've got like 2 patients with frank mitochondrial disease. They are in and out of the hospitals. It is not fun. But you can have mitochondria that just aren't working as well as they should. Therefore, your body doesn't get the molecular energy that it needs. It's still getting some, but a lot of that just seems to get segued over to physical activity. I mean, our kids are bouncing off the walls and blah, blah, blah. They've got a lot of physical activity, but there's nothing left for brain development. There's nothing left for the immune system of the gut to fight these infections. So this whole fight or flight, remember, moves energy over into running away from the tiger. So we've got enough energy to produce to keep me hyper, but not enough for my brain to work, or excuse me, my brain to develop, and not enough for my immune system and my gut. And one of the big symptoms of mitochondrial issues is fine motor skill issues, because my muscles need energy to work, right? And moving big bones like my arms and my legs, that doesn't require many muscles. Like, okay, I got like 2 or 3 muscles here doing this, right? But then all of a sudden I gotta start to work a pen or a crayon or a fork or a spoon. This is a lot more muscles that I need to use. And so the fine motor skills of our hands are the ones that seem to be affected first when we have mitochondrial problems.
Interesting. Is that maybe that's why so many of our kids are in OT to help with some of those things, and it's really a mito issue.
Yeah.
Wow.
Yeah. They're all medical issues. The child isn't choosing this.
Okay. I do have one last controversial question kind of to ask you about Tylenol. What
Sure.
is the deal with Tylenol? I feel like when my son was a baby, an infant, they even were like, just give him some Tylenol for teething.
Yeah.
It's a big no-no, right?
Yes. So I'm glad you brought that up. I'm not sure how to say this. I have no controversy in my brain about it. Tylenol is bad. Throw it
Okay.
out. Throw it out. It's bad. Get rid of it. Short answer. Let me get into the long answer. Tylenol, which is also known as the brand name acetaminophen, which is also known internationally as paracetamol or Calpol, if you have international viewers, is obviously an over-the-counter medicine that's been around since the 80s and marketed massively to children and to pediatricians. And I have patients all over the world. Every pediatrician all over the world uses acetaminophen / paracetamol. Okay. You're pregnant. Have some. You got a fever. Have some. Okay. You're going to go get your shots. Have some. You're teething. Have some. Right. Given away like candy. Okay. And it's given away like candy because medicine thinks it's harmless. Medicine thinks there is very few side effects. Are aware, and medicine and people, medical people all over the world know that you can get toxic. If you take a whole bottle of Tylenol, you're going to go into liver failure. You're going to go to the hospital, and every hospital has a detox program for Tylenol poisoning, period. So we know it's toxic at some level, right? And we all know that there's a detox protocol for it. Every hospital in the world has it. Okay. So why can't our kids take it? My kids aren't going into liver failure, right? Back in the 80s, it was easier to get a drug on the market because the intensity of safety studies, the rigorousness to make sure that safe medications are put on the market, those guidelines weren't there. So Tylenol got on the market really without having to prove that it's safe. And so I just did a podcast on this. I forgot when. I've got the research if you want me to show it here on my desk, but if you don't, that's okay.
Yeah, go.
This is just dumb luck. We didn't plan this. I'll just hold up a couple to the screen if you're watching, if you're reading. Oh, it's going to be backwards, aren't they? Is this backwards
No,
for
I
you?
can read it. I can read it.
It's backwards for me, but it says acetaminophen causes neurodevelopmental injury in susceptible babies and children. No valid rationale for controversy. Okay. Now, this was published last March 2024. There's a guy, hold on, I'm just going through this. Which one do I want to show? This is a good one. All right. A lot of the research on the toxicity of acetaminophen, Tylenol, paracetamol is done by this guy, Dr. William Parker. He's a PhD at Duke. He works with other researchers at Harvard. Super smart guy, right? And he does a lot of this. And I've got an interview with him on our Rumble page if you're ever interested. But he published so much of this stuff. And so here's another one. This is back in 2019. And this says postnatal acetaminophen and autism. And down here, not sure if you can read it, says they believe 40% of cases of autism are from Tylenol poisoning. Okay.
My gosh.
Now, this is just a here you go. Here's another one. The dangers of acetaminophen for neurodevelopment outweighs scant evidence for long-term benefits. Oh, here's another one. Oh, this is good. I'll end on this one so we're not boring
Okay.
everybody. Acetaminophen use in infants and children was never shown to be safe for neurodevelopment.
So why is it not being pulled off the shelves?
It's Let me finish talking about that and then I'll get into that question. That research study says Tylenol, acetaminophen was never tested to be safe for neurodevelopment. And so I think it's really intriguing when somebody says, when your doctor says, yeah, that stuff is safe. What does that mean? What does safe mean to you? Does safe mean this won't cause autism? Or does safe mean this won't kill me if I eat it? All right. Because that research study took a look at all the safety trials they did back in the 80s, proving that Tylenol is safe. And the average study lasted 48 hours. They gave you some Tylenol. They checked in 2 days. You dead yet? Nope. Looks safe to me. They did not check 3 years later and say, oh, wow, all these kids taking it are getting autism diagnoses, right? So
Gosh.
what I showed you is the tip of the iceberg. You start Googling, Tylenol and autism, and you'll see a mountain of research showing that Tylenol taken when pregnant or for the young child massively increases your risk of autism. The research is there and unequivocal. So like you said, why isn't this stuff off the market? Okay. I think it's the same answer for tobacco. Why is tobacco still on the market? How long did it take us to go from the 50s where 4 out of 5 doctors recommended Camel cigarettes? And now we have something on the label. This could cause lung cancer. How long did that take? It takes, you've got Johnson and Johnson who makes Tylenol. How many billions of dollars a year they make from it, right?
Billions and billions.
Literally. You know what? They're not going to let this happen. Just like the tobacco industry didn't want to let it happen. Until the suffering is big enough, that's when a change will happen. And that's a horrible statement about humanity. Too many people need to die or get hurt before something changes. Just like if you remember, again, this is probably 20, 25 years ago, there was a medication called Vioxx, which is an anti-inflammatory medication. Past safety studies, FDA approved it. Now it's off the market because it killed like 20 to 25,000 people. And they're like, oh, I guess we should get rid of it. That's our society. I tend to get a little angry because I hate seeing kids get hurt.
I know, I do too. Although I do feel like this year in particularly, there's been a lot more talk about autism and
Yeah.
rising numbers and what's causing it.
Yeah.
So I do hope that people will open their minds and ears, especially listening to this. And I would love to end on like a message of hope. I mean, what do you say to parents? Never give up. I'm sure you've seen many success stories over the years. I'd just love to end on something like that.
You know what? We always do. It's important to do that because, we talk a lot of doom and gloom. We talk a lot of good things. We talk medical and we go deep. But
Yeah.
you've got a child who wants to be helped. You have a child who might be suffering. And there are so many things that we can do. Okay. People in the autism world, we know what to do. We've seen kids go from being unhappy and screaming to being happy and playing and hugging you, right? We've seen kids go from no words to full language. We see kids improve. We see kids recover their skills. Okay, one of my favorites, and it takes time. Nothing is overnight, right? One of my favorite stories, these set of identical twins I've been working with for 10 years, right? I started seeing them, they were 5 or 6, totally nonverbal, your classic kids with autism. We've done so much work over the past 10 years. Today, they're juniors in high school. They got their driver's licenses. They're going to prom. They're in mainstream school. They're winning their sports. They do track and field, cross country. They're winning state records. They are going to be independent kids. They're going to be independent adults when they grow up. And that's what every parent worries about. Okay. Even myself, we all do. I'm not going to be here. My kid's going to be older. Are they going to be safe? And we can do it. There are answers. So get out there and try.
Thank you so much, Dr. Skowron. I really appreciate you spending your time with me and answering all these questions. It's been a lot of awesome information, and even if this just helps one parent to start helping their kid recover, it's worth it. So thank you so, so much. Where can people work with you, talk to you, get their folinic acid, share all the information?
Well, most everything's through our website, which is Spectrum Awakening. So you can go to our website or, I try to put out a lot of education. So the education's primarily through our podcast. We've also got that on our social media, our Facebook, our Instagram, our YouTube, our Rumble. We've got free ebooks. We've got over 75 different natural supplements that I've developed for my practice and for my kids, and we have them over the counter. We have the lab tests, like the genetics and the organic acid test and the stool test. It's all on our website. Whether you want to learn more, whether you want some of our free ebooks, whether you want to try folinic acid, we've got the doses that they use in the scientific, trials. It's so we just want to help your kids. So anything we can do through our website.
Thank you so much. I really appreciate it.
Yeah. Thanks for having me on, Brittany.
Of course. All right.